Now I'll touch a bit on vector control tools, novel vector control tools. And I think it's something of interest to many countries as they start looking for tools beyond the traditional way of doing things. But before that, probably let me just share with you about this group that WHO has set up in 2012, the Vector Control Advisory Group, or what we call the VCAT. Let me just look at the chat. Okay. Yeah. So this group was set up really to assess the different, the public value of some of these new vector control tools, and really to provide guidance for both the developers as well as some of the countries as to how they can adopt these novel control tools. And among the list of these novel tools, they have broadly categorized them into this few intervention types, and I've provided a list here, the different intervention types. And those highlighted in blues, spatial repellents, vector traps, the SIT combined with microbial infection, as well as the Wolbachia replacement approach, are tools that are currently being evaluated for Aedes control. The rest of the tools are actually being evaluated for Anopheles control. Okay. So for this particular session, I will focus very much on the Wolbachia suppression approach as well as the Wolbachia replacement approach. Whereas the other two speakers will speak on the GM approach as well as the SIT approach later on. Okay. So Wolbachia is very interesting because essentially it's one bacteria with two approaches, really depending on how you use it. So if you use it as a suppression approach where only male mosquitoes are released, this will lead to non-viable eggs, and across time, that's where the population will decline. But if you adopt the replacement where you release both males and females of the Wolbachia infected mosquitoes, that's where you will over time replace the population with the Wolbachia carrying ones. Okay. So let me discuss more in detail of how these two approaches work. So just to give you a bit of background first, so what exactly is Wolbachia? In fact, it's a natural bacteria that's found in a lot of different organisms. In fact, it is first isolated from mosquitoes, I mean, in culex in the past. But essentially, you do find them in things like Drosophila, even in our culex conjugatus and even Aedes albopictus. Aedes albopictus has two strains of Wolbachia as well. So they are actually already in our environment, and there's nothing, I would say, artificial or genetically modified about them. Okay, so that's why essentially when this is being preached and so on, it's a very safe and natural bacteria. So, one interesting fact about Wolbachia is that it's not found in the primary vector of dengue, Aedes aegypti. So naturally, Aedes aegypti do not carry Wolbachia, and then the very question is, then how do you actually have Wolbachia infected Aedes aegypti in the first place? So this is just to show you some of the concepts as to how this is being developed in the laboratory before it's being scaled up. So what you can see here is that Wolbachia is actually the first step is actually to inject them into Aedes aegypti eggs. I mean, in the laboratory setting, what we call microinjection. And the success rate is actually very low. But once you have the egg of the viable egg being hatched out, and if this egg turns out to be a female mosquito, then this female individual will carry the Wolbachia, and she will then subsequently be able to propagate and disseminate, pass on this Wolbachia to her offspring. So one key information to note is that Wolbachia is actually being passed on from mothers to her offspring. Okay, regardless of who she mates with, whether she mates with infected males or non-infected males, or watered males we call it, her offspring will carry Wolbachia, and that's how we can actually generate Wolbachia mosquitoes in our production facilities and so on. So once you are able to generate the Wolbachia line, you can then propagate Wolbachia in a colony by maintaining a healthy colony of your males and females in your colony setting. So now that we have an understanding of how Wolbachia mosquitoes are being generated, let me touch on this what we call replacement approach first. In the replacement approach, there is the release of both males and females mosquitoes. Again, I stress that Wolbachia is passed on from mothers to offspring. So what you can see over here is that you have initially a wild type population at a very high level. And when you start releases of this, what we call the Wolbachia Aedes of males and females, over time, the population will be replaced with this Wolbachia infected population. And this is what we call the population replacement strategy. And this replacement strategy really hinges on, a very key property, that is the pathogen blocking property of Wolbachia. And for those of you who are familiar, in fact, Wolbachia, there's a lot of publication associated with Wolbachia blockage of dengue, chikungunya, and even Zika itself. So this key property is very important because essentially you're trying to replace a disease-transmitting population in your environment with a pathogen-blocking population, such that your ultimate vector population has a reduction in vector competence, and subsequently that will lead to very low level or even very low level of transmission in the community itself. So one very strong program, global program currently is the World Mosquito Program, or the formerly known as the Eliminate Dengue Program. And currently, if I just checked the website yesterday, that I think there are 11 countries being involved in few trials of releases in different country settings. So they really started off their releases in Australia and subsequently in Vietnam, Indonesia. But now more and more countries have started some form of trials. And I've also shared some of the reduction in dengue burden in their study location. But what's more important, interesting is that a few months ago, I think August, September, they did announce they've completed the randomized control trial in Indonesia, Jakarta, and they've reported about 77 to 79% reduction in dengue. So I think we are very interested to wait for the final publication of the results to see, how useful is this tool for reduction in dengue burden in endemic countries. So following from the replacement approach, now I'll move on to the suppression approach. So in this suppression approach itself, that's where you only use the Wolbachia infected males. So in this male release only strategy, males are being released in the environment. And what's interesting is that when males are being released and they mate with what we call urban or wild type females, it leads to this biological phenomenon known as the cytoplasmic incompatibility, which ultimately lead to the eggs being non-viable and eggs do not hatch. So there's still a lot of studies being done as to how and why this is happening. But essentially, this is a very useful tool that we are actually capitalizing on, or this concept is capitalized on, to really help with the population suppression in our environment. So as you can see in the graph here as well, as you release this, what we call the male carrying Wolbachia Aedes aegypti in the environment, over time your population will decline and be at a low level where transmission does not happen. So this suppression approach using Wolbachia carrying males is actually not unique or not really new. In fact, back in 1967 in Myanmar, they've really started a small trial using Culex conchifaciatus using a different strain, and they did manage to collapse the population. Of course, only back in the last 10 years or so, that's where more countries started to really look into this approach again and to test on how this approach can be used for population suppression. And you can see the whole list here with the different countries embarking on Wolbachia. And we have also provided a link so they can read up a bit more later on. So in Singapore, we have also embarked on the Wolbachia approach combined with the SIT low dose to actually sterilize out the females that may not be sorted out from the method. And let me just share with you the video as to a bit more of our project and how we have really from the point of studies to engagement and some of the results as well. Okay.
Project Wolbachia Singapore involves the release of male Wolbachia Aedes aegypti mosquitoes to suppress the urban Aedes aegypti mosquito population. When a male Wolbachia Aedes aegypti mosquito mates with a female urban Aedes aegypti mosquito that does not carry Wolbachia, their eggs do not hatch and there will be no offspring. Regular releases have reduced the dengue mosquito population by up to 90% and have sustained it at a low level at the study site. This was achieved through a multi-phase field study conducted at Rebel Heights, Tampines, Yishun, and just recently in parts of Chachuka and Bukit Batok. We succeeded in understanding the behavior of male Wolbachia Aedes aegypti mosquitoes in the field and mitigated ecological challenges posed by Singapore's high density and high-rise environments. The project is made possible with strong support from the community. Wolbachia is a naturally occurring bacteria found in more than 60% of insect species, including butterflies, fruit flies, and other insects. Wolbachia does not harm humans or other animals. A Wolbachia carrier mosquito is not a genetically modified organism. Wolbachia technology is being field tested, following rigorous scientific research and extensive risk assessment. As the project progresses to a larger scale, automated technologies are concurrently being developed to ensure easy and cost-effective adoption. Multidisciplinary project is enabled by our close collaboration with various partners. Wolbachia technology will complement Singapore's existing vector control efforts. Excessive mosquito breeding in the community will hamper the effectiveness of the Wolbachia technology. NEV will continue to work with grassroots leaders, residents, and other stakeholders to fight dengue together as a community.
I hope that gives you a brief overview of our program that we're running here at the moment. So we started off the journey of Project Wolbachia quite a while ago, I think 2012 when we started the laboratory assessment, the risk assessment and so on. And we only started our first release in 2016, about 4 or 5 years ago, really to understand the behavior of our male mosquito in our environment. In particular, we really want to know how high they can fly in our very high-rise setting. And from then on, we really design our study to address some of the challenges that we face subsequently in our releases itself. And currently now in our phase 5 studies, we have actually covered quite a substantial part of the towns that we have been working on. So when we started off about 39 blocks in back in 2016. Now I think we are covering about 1,000 blocks, so it's quite a substantial increase in the coverage that we have and so on. And of course, you can, as you see in the video earlier as well, along the way, while we are talking about really scaling up our project to move into more areas and so on, essentially that is also complemented by the development of technologies to really go hand in hand to be able to supply the mosquitoes needed for our releases itself. And you can see during the video we have collaborated and developed different gadgets, from the larvae counter to really facilitate our counting of the larvae, to the high density systems and so on, to really make sure that our male mosquitoes, when we release in the environment, they are optimal, they are healthy, and they are competitive to be able to compete with our wild-type urban males in the environment. And we really stress a lot on the quality of our mosquitoes, so that so that we don't have to release more. So one thing unique about our community over here is that they are not very tolerant about mosquitoes, and that's why even release of male mosquitoes that do not bite, we do receive a lot of feedback, which you will hear a bit more from Catherine later on. Okay, she'll share a bit of our communication here, but our emphasis here is really quality over quantity. So as you can see in the video, and just to emphasize here that we have really seen very good suppression of our urban Aedes aegypti population in our release location. And what we saw in some of our study locations is that there is a reduction in dengue cases of up to 70% reduction in our location as well. So that is really very encouraging, and that's why we are actually pushing ahead to bring these releases to actually more locations as well. So while we talk about the suppression and replacement approach, I think what's key is that we are aware of the different factors or different considerations that we need to account for, you need to think through before we embark on something new and so on. So this table really compares, gives a very simple comparison between the two approaches, the suppression and replacement approach. And as I emphasized earlier, one strategy is really focused on the male release only strategy, whereas the other strategy is focused on both the males and females. And the factors impacting the success of the approach is very important, because the suppression approach really depends on the fitness of the male mosquitoes to compete with the wild type mosquitoes, so that it will lead to a population suppression across time. Whereas the replacement approach heavily relies on the key property of a pathogen blocking ability of the Wolbachia strain to ensure that subsequently there's no or very little transmission in the community. So these are considerations that you have to be aware of as well. And of course, the rest of the considerations is something that you can think through and read through as well. But ultimately, whatever tools that we embark on, I think we cannot forget the importance of integrated approaches. I mean, I've talked about surveillance, and ultimately now it's the vector control itself. The whole disease transmission for dengue or any form of vector-borne disease really has this very tight interaction between your pathogen, your vector, your human, and environment. And you really need to tackle all these different angles, plus your new control tool that you want to integrate to ensure the success of the vector control program that you are working or planning. And with that, let me share this very new special edition publication, very recent as well. And you can take a look at this particular publication, where there's a lot of different new papers talk about new technologies, where they've done a very nice review of the different new tools at the moment. So something that you can look forward when you have the slides. So with that, thank you for your time, and I'll take the questions probably later on.